One of the ways that I think would help us is to think about public health in terms of three core functions: assessment, policy development, and assurance.
A focus on structural conditions that contribute to health risk factors. Differences in health outcome can be attributed to inadequate income, one's socioeconomic position, and the quality of the physical and social environments as examples of structural influences. In addition, family context, household composition, parental involvement, employment status, and working conditions must be considered. Individual factors such as race, gender, childhood trauma, exposure to violence, and the ability to cope with adverse experiences matter.
A balance sheet can also be described as a snapshot of an organization's financial condition. A balance sheet is broken up into two sections: assets on the left-hand side and liabilities and equity on the right-hand side. Assets always equal liabilities plus equity. That is, the balance sheet always balances.
Approximately 58% of state public health agencies are freestanding. This means that they're isolated in their own unit. 43% of them are then a unit of a larger umbrella, nested inside of another department, basically. Approximately 100,000 people work in state health agencies across the country. Smaller states tend to have the fewest number of staff, but are responsible for fewer citizens. This means that larger states might have more state health department employees, but those employees are actually responsible for a larger number of people.
Healthcare organizations, for instance, receive large portions of their revenues from providing care to patients. The income statement then presents the expenses incurred by an organization. Expenses are the costs incurred to generate revenues. Examples include salaries and wages, supplies, utilities, and interest expenses. For most healthcare organizations, the single largest expense is the salaries and wages paid to employees.